my previous lecture, you have learned how corticosteroids are useful in the management of adrenocortical insufficiency. Corticosteroids are also of great value in the treatment of various types of eye diseases. So today here we are going to learn about the indications of the uses of steroids in eye, together with the choice of agent and the mode of administration of ocular steroids. Also, the side effects and complications of these steroids will be discussed. So, starting off with the commonly used steroids in ophthalmology, and the drugs are cortisone, prednisolone, dexamethasone, triamcinolone, fluocinolone, and some of the newer steroids such as fluorometholone, loteprednol, remexolone, and difluprednate. So, these are some of the examples of steroids that are used in ophthalmology. So now let's see what are the uses or indications of these ocular steroids. The major use of ocular steroid is to suppress inflammation. So they are used in various types of inflammatory diseases in the eye. They are useful in allergic conjunctivitis, where they help to mitigate allergic inflammatory responses. They are used in ocular conditions where the cornea is inflamed, for example, interstitial keratitis, and also in corneal injuries and ulcers, where they aid in the healing process by suppressing inflammation. Thirdly, they are useful in uveitis or inflammation of the uveal tract, and the uveal tract consists of three parts, that is the iris, ciliary body, and choroid. So, inflammation in the uveal tract responds well to corticosteroids. Next, intravenous corticosteroids have been found useful in the treatment of optic neuritis or retrobulbar neuritis, where they help to speed up the recovery of vision, preserves eyesight. Corticosteroids are also useful for treating injuries to the eye, for example, the injuries caused by trauma or the injuries caused by chemicals or burns. They are also useful after post-ocular surgeries to speed up the recovery process by decreasing the inflammation in the eye. So now that you are familiar with the steroids that are used in the eye and the list of various inflammatory eye conditions, so now the question arises how to select an ocular steroid for a given eye condition. So what are the factors that determine the pharmacological selection of an ocular steroid for a given eye condition? So the selection depends upon three main factors. So the first one is the anti-inflammatory potency. So the steroids differ in the anti-inflammatory potency. So if you compare prednisolone with dexamethasone, dexamethasone has more potent anti-inflammatory effect than prednisolone, and therefore dexamethasone is preferred over prednisolone in severe inflammatory conditions of the eye and is widely used. However, dexamethasone causes more problems with the intraocular pressure than prednisolone. The second factor that is taken into consideration is the penetration capacity, the penetration through the cornea into the eye, and this depends upon lipophilicity. So lipophilicity determines the penetration capacity through the cornea, and if we compare hydrocortisone with prednisolone, hydrocortisone is more lipophilic agent, so it easily penetrates through the cornea into the eye and produces local effects with less side effects. Whereas prednisolone has less penetration through the cornea and is more preferred as a systemic therapy. They are used orally, they are used intravenously. The third factor is the side effects. It has been reported that long-term use of steroids increases the risk of intraocular pressure or cataract formation, and therefore newer steroids such as loteprednol or remexolone have a better safety profile. They are less likely to produce side effects, and therefore they are preferred drugs for long-term use in various eye conditions. So an ocular steroid is selected based on its anti-inflammatory potency, the penetration through the cornea into the eye and producing local effect, and thirdly, the safety profile of the steroid. So next is what are the different modes of drug administration into the eye. There are various methods of drug administration into the eye, and the most common one is the topical preparation, the topical eye drops and ointments. Secondly, the injections, the subconjunctival injections, retrobulbar injections, and intravitreal injections. And thirdly, systemic therapy, either oral or intravenous therapy, are very useful in treating inflammatory conditions of the eye. So next is how to choose the method of administration of the drug in a given eye condition. It is to be kept in mind that the method of drug delivery depends on the part of the eye the drug has to reach. I once again repeat, the method of drug administration depends on the part of the eye the drug has to reach. For example, in diseases of the anterior segment, for example, conjunctivitis of the cornea is affected. So topical eye drops, ointments are very useful in such cases. In severe anterior segment diseases, subconjunctival injections can be used. Then there are injections such as intravitreal injections which directly delivers the drug into the posterior segment and is useful in treating inflammation of posterior segment which involves the vitreous body, choroid and retina. So in posterior segment diseases, intravitreal injections or retrobulbar injections are very useful. So intravitreal injections and retrobulbar injections are very useful in treating posterior segment diseases as a smaller dose is used compared to systemic therapy, and this reduces the likelihood of side effects. However, when these injections fail to produce adequate response or there is failed local therapy, then systemic therapy such as prednisolone can be used orally or intravenously for the treatment of various eye conditions such as severe ocular inflammation or optic neuritis, and this helps to preserve the vision, speed up the recovery of vision and are preferred in severe inflammatory conditions of the eye. So to sum up, if the anterior segment is involved such as the conjunctiva or the cornea, topical eye drops and ointments are useful. In severe anterior segment diseases, subconjunctival injections can be used. In posterior segment diseases, intravitreal injections and retrobulbar injections are preferred. And systemic therapy, that is oral or intravenous prednisolone or methylprednisolone or dexamethasone, can be used in severe ocular inflammation when there is failed local therapy. Next, we move on to the side effects and complications of steroid therapy. The side effects of steroid therapy depends on the dosage and the duration of treatment. So the side effects can be divided into systemic side effects and ocular side effects. As we are aware that oral or intravenous steroids when used for long term increases the risk of systemic side effects such as weight gain, hyperglycemia, hypertension, osteoporosis, increased risk of infections. So these are some of the systemic side effects of steroid when used in high doses for prolonged period. The ocular side effects can occur irrespective of whether the drug is administered systemically or locally. One of the side effects of steroids is the rise in intraocular pressure, and this occurs because of alteration in mucopolysaccharides of the trabecular framework, and this prevents drainage of the aqueous humor, leading to a rise in intraocular pressure. So persons with pre-existing glaucoma experience a significant rise in intraocular pressure. So the intraocular pressure needs to be monitored regularly to prevent complications. Dexamethasone, which is more potent than prednisolone, is more likely to cause a rise in intraocular pressure in eye diseases. Secondly, prolonged use of steroids increases the risk of posterior subcapsular cataract formation. However, the mechanism for cataract formation is not known. These steroids increase the risk of secondary infections, secondary bacterial infections or viral infections, and this is because of its immunosuppressive property. It reduces the tissue defenses and increases the risk of infections such as herpes simplex infections. It also worsens fungal infections, it enhances fungal infections because of its immunosuppressive property. Also, one of the complications of steroids is that it masks the symptoms while causing progression of the infective agent. So while it reduces the symptoms by decreasing the inflammation, the progression of the infective agent continues. So the underlying cause needs to be treated, otherwise it can lead to worsening of the ocular disease by causing progression of the infection and reducing the signs and symptoms, and this can lead to loss of vision because of the progression of the eye disease. So steroids have multiple benefits, but they should be used with caution. The lowest effective dose of the steroid should be used. The steroid should not be used for prolonged period, as they can increase the risk of systemic side effects. So limit the duration of use of steroids. Thirdly, the method of drug administration into the eye should be correct. Localized drug delivery methods should be selected or should be preferred over systemic therapy. However, in severe conditions, systemic steroids are essential. Thirdly, newer steroids have lesser side effects and they have a better safety profile. Therefore, newer steroids such as loteprednol, rivaroxaban, fluorometholone are preferred as they produce lesser systemic side effects. Also, the patient should be monitored for a rise in intraocular pressure. The patient should be educated regarding the risk of side effects so the side effects can be prevented. So in this lecture, we have learned about the commonly used steroids in ophthalmology, the list of various inflammatory conditions of the eye, how to select a steroid for a given inflammatory condition of the eye, how to administer the drug in a given condition. Also, the side effects and complications have been discussed. So thank you for watching. If you find my video useful, please like and subscribe to this channel.